Welcome to the next Digital Health Report from Stockholm.
Today we have Niklas Sundler, who is the head of Telia Healthcare, one of the youngest branches of the communication giant Telia. Telia Healthcare promises to bring solutions that would make the healthcare more effective. Welcome, Niklas.
Thanks.
It's a pleasure to have you here, and I will shoot the first question that most of the audience will ask. Why did TeliaSonera, being a communication provider, decide to go to healthcare?
I think it's an important role, and we are today helping the society with the digitalization and putting up the new kind of services that we need to take the next step into the future. And one very important area for that is the health. And since we both have the private side as a customer, and we are strong value on that side, and we are also on the enterprise side with the country council and municipalities. It's interesting that the kind of services that you will sell to the private side and the consumer can add a value to the municipalities and country council. And opposite about that, the things that we sell to the municipalities, we can add a value to the private side too.
Great.
So could you please tell us more about Telia Healthcare, the solutions that you're offering?
Yeah, I took some pictures with me here. And this is an overall picture about the kind of offers that we are taking out now. So we have decided for 5 different offers to start with. And there are different pieces adding a total picture about what you need and how we can help you in the digitalization. So one of the offers is home care, who is the part where you connect the home with the healthcare workers. Another one is Pro Care, who is the one that connect the healthcare workers inside the hospitals or inside the healthcare. And another one is the patient inside the healthcare, which gives them the possibility to give a view. They can do an entertainment first, and then they can add on different kind of services, communications to the doctors and so on. And then we have the guide perspective, which are the point when you are at home and you would like to be a patient, or when you're getting a patient. So you will get different kind of service to help you with that. Then of course we have the integration part where we integrate and put the services to work together with the national e-health initiatives and Inera's tjänstekatalog and so on.
So how do you see the future of Telia Healthcare as a market player for digital health?
I think that Telia have decided when we do something, we do it all in. We decide to be one of the more important actors. And we also see that if you see one of the offers, home care, it's an offer where you can add different kind of sensors and you will store your information in a private account. And from that account you can communicate to different kind of actors. So that means that we will take a different kind of role than we have done before, but we will probably be a role where we can help different kind of other actors that would like to add on different kind of services.
So on a very basic level, if I'm a user of your home care solution, what can I expect coming home?
You can accept it. If you look shortly on the next picture here, you can see this is a little technical picture, of course, but it gives you a point of different kind of sensors. If you look on the top, it could be sensors that will give you a safety comfort. It could be sensors that will help you with your health. It could be sensors that if you have a chronic disease, you can connect them, and all of these values and all this information will give an extra value to you and give you the possibility to feel more safe and take better care about your health. So one, you asked for a sample. It could be that you have if you are problem with your weight, or as normally you have a problem with your heart, as an heart. I'm sure what to call it in English, but you will need to measure your heart your weight every day. By that you can understand if you need to adjust your medicine, for example. And so that is an easy thing that you can do. But you don't really want to have 4 scales or 4 things to measure your weight with, because you have different actors that would like to have have the information about you. You want to have one, and you want to have it to work with a proper way with your normal lifestyle. So that is what we are aiming for, that possibility and that opportunity.
On another level, security is one of the main issues when it comes to users as well. What are your plans to provide users with more security and reassure them?
I think that there's of course a lot of difficulties in that area, and there's a lot of things to address. One of the things that we have done is that we are using a box in your home, which we connect everything through, meaning that we have a tunnel and we have a secure way to make the communication work. We can also use that tunnel and that box. Here it's called Residential Gateway on this picture. It's a box that also the healthcare or doctors can use when they visit a patient at home to connect up and get the communication in a secured way. So that is one example of what we're doing.
And it sounds very positive and with a lot of perspectives, but what are the challenges you foresee in the future for Telia in the digital health field?
I think that if you look to Telia today, you can't really see, or you haven't been able to see, that Telia done anything inside the healthcare area. I mean, of course, we have been providing video solutions, and we have been providing telephones and sensors of different kind, and so on. But what you will see the next step and what's coming up is that we would like to help you as a person much more, and you can get a much wider service from us as the kind of way that you can't do today. And you will also see in the stores, you will see sensors coming up, you will see the possibility to order things from our webs and so on, step by step.
So do you see technology, business, or some other challenges as the biggest challenges, let's say?
Ooh, that's a tricky question. I think it's all of them are really tricky for the moment. We don't have a system inside the hospitals today where you can get the right kind of payment for different kind of digital services. We know that the patients, some of them, of course, are into the digital service and the services of different kind, but some is not. And so they need to adjust and understand what this means. And then, of course, you have the people working there who is used to an environment where they are the owner of the information, and they are the part that are deciding what will happen. But if you look into the future and you can see what's happening in all of the rest of services that have been digitalized, banks and so on, you can see that it's actually the consumer or the customers is driving.
Okay.
So this will be very interesting to see how this will fit in the future and actually what will happen.
Yeah, finally, we'd like to ask you, how do you see the future of digital health, both as Telia and in general as well?
Of course, it's a growing area, and of course it's an area with a lot of interest in. And if you look into, for example, the Swedish society, and you look into what's happening in Europe, we are getting so much more elder people, and the taxes and the money in the society will not be enough. So we must do a digitization, and it must happen now. We are having out there municipalities and country council, they are discussing about, we have a time frame of like 5 years or 10 years between we really need a big change. Otherwise, we don't know how we should survive. And if you look into the private or the consumer market, I mean, the change is happening now. They're expecting a lot of change every month. And so this means that there will happen a lot. And I think both from a Telia perspective and also from a society perspective.
Great. Thank you, Niklas, for coming here. It was a pleasure to learn more about new initiatives within telecommunication business as well.
Thanks.
And please stay tuned for our next digital health updates, and we will see you in the next video.
Thanks.